This is Dr. Fox. Let's talk about the pharynx. In this video, we'll discuss the pharynx, its subdivision, and the borders between those subdivisions, and also discuss any of the major contents within those spaces. Finally, we'll describe how substances may travel among or between these spaces. So the pharynx, or the throat, is a common aerodigestive pathway that links various spaces such as the nasal cavity, the oral cavity, the larynx or voice box, and the esophagus, which is the muscular tube that leads down to the stomach. So we have both food and beverage stuff moving through here, saliva, we have air moving between all of these spaces, so it's a relatively important space within the body. It's subdivided into three major spaces: the nasopharynx, the oropharynx, and the laryngopharynx. And these spaces are all named for other areas that are contiguous with them anteriorly. So let's have a look at these subdivisions and some of the boundaries between these subdivisions and other spaces. So let's start superiorly, start at the top with the nasopharynx in green here. The nasopharynx is located posterior to the nasal cavity, which we can see the nasal cavity here. And air moves between the nasal cavity and the nasopharynx through what are known as the choani. The choani, or singular choana, are the internal nostrils, or nares. So we can see a choana on that side. That's one boundary for the nasopharynx. The other boundary is a line drawn from the soft palate. So the palate is the space above the oral cavity. There is a hard palate supported by bones, and posteriorly that soft palate extends, and we can see that boundary there that helps us to divide the nasopharynx from the oropharynx, which is below it. That oropharynx is contiguous anteriorly with the oral cavity, and we can see the tongue is one of the major constituents of the oral cavity there. The other boundary for the oropharynx is the epiglottis, which is formed by mucosa going over the epiglottic cartilage, along with the pharyngoepiglottic fold there. So we can establish that as the oropharynx. And then finally, the laryngopharynx is the space that is inferior from the oropharynx. It's bounded by the laryngeal inlet there. That's the space through which air is going to move into and out of the larynx. And then the inferior border for the laryngopharynx is the inferior border of the cricoid cartilage. So that cricoid cartilage, we can see a little bit of it there and a little bit of it there. That's approximately at the level of the sixth cervical vertebra there. So everything inferior to that border or boundary is the esophagus. So that muscularized tube that is heading down to the stomach. Let's take a look at some of the contents of these spaces. So let's begin with the nasopharynx. Superiorly within the nasopharynx, so kind of along this surface here, we have the pharyngeal tonsil, also known as the adenoid. So if you ever have heard of someone having their adenoid, sometimes they say adenoids, plural, this is incorrect, they have that removed, that's what they're talking about, that pharyngeal tonsil. It's a little bit of mucosal associated lymphatic tissue along the superior edge there. And we'll discuss that in greater detail when we discuss some of the tonsils and Waldeyer's ring. We also have the Pharyngotympanic Tube, also known as the Auditory Tube, also known as the Eustachian Tube, and I'll circle that here so we can see the opening of it there. That is a pathway between the nasopharynx and the middle ear. So if you've ever had that experience of your middle ears popping, that's air moving through that tube as pressure equilibrates as you change either altitude or depth or enter into a situation of different pressure. Sometimes associated with the margin of that is a little bit of malt tissue, that mucosa-associated lymphoid tissue, known as the tubal tonsils. Moving inferiorly, we're going to take two radically different views here. One just of from the anterior, including the tongue, and another just as a different medial view of this space here is the oropharynx. The oropharynx is divided from the oral cavity by the palatoglossal arch, and I'm just going to draw little bits of that arch there and there. Those would connect along the top. The palatoglossal arch is formed by the palatoglossal folds. The folds are mucosa that surround little bits of muscle called the palatoglossus muscles. These are muscles that insert into the tongue that really aren't germane here, except to say that they help form these folds that are the boundary between the oral cavity and the oropharynx. So behind that palatoglossal arch, there is a palatopharyngeal arch right there and right there. And those two arches are going to delimit a space known as the fauces. So here, let me draw that over to there. So that space between the arches is the fauces, which is Latin for throat, yet again. And the fauces is a large part of the oropharynx, which contains some very important structures. So first of all, along that lateral wall of the fauces, we see palatine or tonsillar fauci that contain palatine tonsils. So the palatine tonsils are the malt tissues that people refer to as the tonsils. So if you ever have your tonsils removed, we're talking about those palatine tonsils there. And there's more tonsillar tissue here. So this is the lingual tonsil. This is the root of the tongue. And the surface of the root of the tongue is the lingual tonsil. So we have a lot of lymphatic tissue along the walls and the floor here of the fauces. Really, really fortuitous for us as we bring materials in from the oral cavity, those materials come in contact with that lymphoid tissue so as to get the immune system ready, are primed for any bad actors that are entering as well. The other structure of the oropharynx that I want to draw your attention to is the epiglottic valleculae. So the epiglottic valleculae are these little troughs formed by the root of the tongue and the anterior surface of the epiglottis here. And what happens is saliva is conducted down and then can be stored in those epiglottic valleculae so that it doesn't move into the rest of the oropharynx to trigger the deglutition or the swallowing reflex. So that buys us some time so that we're not constantly gulp, gulp, gulp swallowing as a result of saliva that comes from our oral cavity. These epiglottic valleculae are a very important anatomical landmark and physical landmark for laryngoscopy. So that is when we visualize the larynx, and here is the inside of the larynx there. What happens is the blade of a Macintosh-style laryngoscope inserts there, and it can draw the tongue and subsequently the epiglottis forward so that one may better visualize the larynx. And then finally we have the laryngopharynx, and this is a posterior view with the mucosa stripped away. Let's show you some interesting boundaries and contents here. So recall that the boundary between the oropharynx and the laryngopharynx are the pharyngoepiglottic folds as well as the epiglottis. Well, here are those folds, there and there, and here is the epiglottis. Those pharyngoepiglottic folds are formed by mucosa going over a muscle called the Stylo Pharyngeus muscle. The stylopharyngeus muscle is a muscle that we will see in the laboratory as well as discuss in a subsequent learning objective, and that helps to establish that fold, which is the boundary between oro and laryngopharynx. I'm just going to continue this outlining here so that we can see the full structure of the larynx, which would be the voice box, which is the proximal portion of the exclusive respiratory pathway. So here is the laryngeal inlet. This is the space by which air is going to enter and leave the larynx. And just laterally to the larynx, we have two spaces called the piriform recesses. Sometimes materials, namely dry pills, can get stuck in that piriform recess, and it might make you feel as though there's something stuck in your throat. Here is the cricoid cartilage, and at about the inferior margin of that cricoid cartilage is the inferior border of the laryngopharynx, so anything below that will be within the esophagus. Good. So we've discussed the pharynx as an aerodigestive pathway, pointing out many of the lymphoid structures along the way, which comprise Waldeyer's tonsillar ring. That will be the focus of a subsequent video. We've also discussed the naso, oro, and laryngopharynx and their boundaries as well as some of their major contents. This is your summary slide. Thank you for your time.